My name is Kip Adrian, and I'm a board-certified emergency physician. I practice in Illinois and Indiana. In general, I think that the sentiment of the majority of patients that I see is that they're concerned about their ability to obtain quality health care. And this affects them in a variety of ways. For instance, I regularly see patients who are not taking medications which are vital to their well-being, and they put themselves in great risk by not doing so because they can't afford the prescriptions, even though they're insured, supposedly. I see patients that are unwilling to be admitted to the hospital because they don't want to be labeled with a particular diagnosis for fear that they may be labeled with a pre-existing condition and not be able to get health insurance down the line, or maybe dropped from their current policy. These are huge barriers for patients, and what I see is overall people struggling more and more to find adequate health care in a way that makes them feel safe and secure. I find myself dealing with the business of medicine more and more on a daily basis, figuring out which formulary a particular insurance company works with, or if a particular specialist will be covered for a particular patient who comes in with a medical condition that requires referral. I deal with utilization issues in terms of what tests can be ordered under what insurance company and what tests won't be covered if I order them for the patient. I have to figure out which particular admission criteria a patient has to meet in order to come into the hospital. It's not
I'm Dr. Charles Martinez, and about almost 2 years ago, myself and my partner opened up a free clinic for the uninsured in our neighborhood here. And we wanted to help people who had no insurance or lost their insurance, because after doing some studies we realized there was a large number of people, but we didn't expect this many in this neighborhood. Over this year, since last summer to now, we've doubled the number of patients we're seeing, and the stories are all the same. They've either lost their job and lost their insurance, or they're on a job that is low paying and can't afford to give them insurance. One of the larger free clinics in the area noticed a 73% increase in patients since the recession started. We serve all these people. We see severe chronic diseases, and we have them by appointment. They're very grateful to the place. We survive on grants, but the need is so tremendous. We're shocked, really, and we're doing what we can to try and make a dent in this terrible problem.
My name is Melinda Steele. I'm a licensed clinical social worker practicing in the state of Illinois. I am a psychotherapist, and I see individuals, couples, families. Insurance can sometimes be confusing, and I've been working with insurance for over 30 years, and I find it confusing. So it's often very confusing for the clients that come to me. Very often, certain insurance companies, the really large ones, will farm out their policies, certain sections of their policies, to what we call managed care. And this is often where it becomes very confusing for the client. I am on several insurance panels, but if that particular insurance company that I'm on their preferred provider panel, for instance, gets farmed out to managed care, and I am not on that particular managed cares panel, then the client's treatment is considered out of network. The other thing that happens is clients are limited to the number of visits. They're limited to the type of diagnosis. Marital, for instance, isn't covered, even though there can be diagnosable conditions with individual patients within that dyad that affect the relationship. the actual work between the couple, if you know, as marital counseling is not covered. I had a couple of clients that I saw with an insurance company that I was again on the preferred panel, but I wasn't on that particular policies section. So we spent 6 months where I would send in a claim and they would that month cover the client and the next month not cover the client. When that policy changed, they no longer would cover me because they only would cover psychiatrists or I think they said licensed nurses who were giving medication and one other profession, but not LCSWs, which are mastered level therapists, and they do the bulk of the therapy in the United States. When I think about health, what needs to be changed, or if we need to change healthcare, I certainly do. I think that as I said, I see insured people, but even within the insured companies, the people that are insured, there's such a wide range in terms of how they're covered and if they changed policies to get better rates. That it's very risky, and you can go from being insured to not being insured or not being insured adequately, in a blink. So it becomes really difficult for even working people to feel like they can protect their families with the proper amount of insurance and still cover the costs that are out there.